identify existing gaps, collectively decide on path towards improved prevention, diagnosis, treatment, and care. Ladies and gentlemen, sickle cell disease remains one of the most prevalent inherited blood disorders in Ghana. Each year, it is estimated that about 2% of newborns are affected, with many more born with the sickle cell disease traits. Beyond its health implication, ladies and gentlemen, sickle cell disease affects education, productivity, livelihoods, and overall well-being of families and communities, not to talk about immediate families as well as extended families. So recognizing the growing burden of this disease, in November 2024, the Ministry of Health, in collaboration with key stakeholders, launched the National Strategy for Sickle Cell Disease that covers 2024 to 2028. So this strategic framework seeks to improve awareness and health education, strengthen screening and diagnosis systems, enhance clinical management, and access to care, establish robust data and research systems, and promote partnerships for sustainable financing and implementation. Because whatever initiative we are taking, remember, it will require resources to implement. The following year, the ministry also launched the sickle cell disease screening and case management guidelines, which provides framework for standardized screening, diagnosis, treatments, and follow-up care across the country. While these developments represent significant progress, we acknowledge that important challenges still remain. Newborn screening coverage is still limited. Access to diagnostic services varies across regions. Many families face financial and psychological barriers to care, and the misconception and stigma continues to affect health screening behavior. These are also adding up to the gaps in research, data management, and resource mobilization that require our urgent attention. Distinguished ladies and gentlemen, these are the challenges we must collectively confront and find solutions to them. The ministry acknowledges that sustained progress, and then the sustained progress will also depend on deeper collaboration between stakeholders, including government professionals, advocates, private sectors, private laboratories, universities, community networks. No single institution can tackle the burden of sickle cell disease as we speak now. And so we therefore remain committed to working with all partners to close these gaps by giving priority to 4 things that I've identified that if we put our minds to it, it will help us scale the trend of this disease. Number 1, scaling up universal newborn screening and integrating sickle cell testing into child welfare clinics. 2, expanding genetic and wellness counseling. I know this part is very, very prominent in the Christian religion, usually when they are doing the premarital counsel. Where it is weak and does not see prominence is the Islamic side. Usually the counseling is dedicated to what I call being faithful to partners without looking at the health aspect of it. I think we have to learn from the other religions how they are able to integrate the counseling, particularly when it comes to sickle cell issues. The third one has to do with establishing national standards of care and training healthcare workers across all levels of health delivery system, consistent quality sickle cell disease services. The other one is strengthening public health education and advocacy because, as I said, we still have the challenge of stigma, including school-based and community awareness programs to reduce stigma and promote informed health-seeking behavior. The last one, the distinguished participant, is promoting financial protection for persons living with sickle cell disease. I think those who were here earlier, we saw the videos that they ran, how people or families are going through these challenges. So I'm particularly pleased that this conference brings together policymakers, researchers, health professionals, patients, caregivers, civil society organizations, and international partners. Such broad representation reflects the collective leadership and collaboration needed to advance Ghana's response to sickle cell disease. I am confident that by the time we are leaving here, with the scientific presentation, panel discussions, and plenary sessions that we will have today, will generate valuable insights and practical recommendations, including what I've just presented to you, that will help shape future policy and program intervention. As I conclude, distinguished ladies and gentlemen, on this note, I formally accept the role of chairman for this important conference and pledge my full support to all the proceedings. And I encourage all participants to actively engage in the discussion, share experiences and best practices, and contribute meaningfully towards identifying sustainable solutions that will improve the lives of individuals and families affected by sickle cell disease in Ghana. Let us continue to work together and work hard towards future where everyone or every person living with sickle cell disease has access to timely diagnosis, quality care, and the opportunity to live healthy and productive life. On these notes, ladies and gentlemen, I want to thank you for the honor, and I wish us all successful, productive conference, and pray that may the good Lord guide our activities and the conference. Thank you very much.
Thank you very much, Chair, for accepting this responsibility. We are also grateful to you, and we pledge our support. Thank you very much. Let's give him another round of applause. So before the statement by Dr. Pascal Kingsley Wayne, I'd like to acknowledge in our midst His Excellency Kwesi Chedua, the Presidential Special Envoy to the Caribbean region. His Excellency Kwesi Chedua, thank you. Presidential Special Envoy to the Caribbean regions. Thank you very much. And we also have in our midst Ambassador Dr. Winfred Ni Okai Hammond. He is a former Ghana's ambassador to People's Republic of China between August 2021 to December 2024, and Arab Republic of Egypt between March 2019 to July 2021. You're welcome. So let's invite Dr. Pascal Kingsley Wayne from World Health Organization to give us a statement.
Thank you very much. Your Excellencies, as I can see so many of them in the room, so I wouldn't be able to mention all the names. The chairman for this occasion, Dr. Hafiz Adams, representative from the Ghana Health Service. I see the Director of Public Health here. My dear cherished partners and stakeholders, colleagues from the media, ladies and gentlemen, I wish to stand on the existing protocols that the chairman has already established, for whom I have not been able to mention all of them. And good morning, everyone. The World Health Organization is pleased to join the International Sickle Cell Center, the Ministry of Health, the Ghana Health Service, development partners, healthcare professionals, researchers, civil society organizations, and more importantly, our warriors who are living with sickle cell disease in commemorating the World Sickle Cell Day 2026. I would like to first of all commend the International Sickle Cell Center and its partners for demonstrating leadership in organizing this third annual national conference. Your efforts to elevate the discourse on sickle cell disease and to convene diverse stakeholders for meaningful dialogue like this exemplify the kind of leadership and collaboration needed to drive change. The theme for this conference reflects a fundamental question confronting many countries across African region. How do we translate growing knowledge, proven interventions, and policy commitments into measurable improvements in the lives of people living with sickle cell disease? For Ghana, this question is particularly relevant at a time when important policy, pragmatic, and health system reforms are underway. Sickle cell disease remains one of the most significant inherited disorders globally and continues to impose a substantial burden on individuals, families, health systems, and national development, particularly in sub-Saharan Africa. In Ghana, where approximately 18,000 children are born with sickle cell disease annually, the condition remains a major public health concern, requiring sustained attention and investment. While sickle cell disease is often viewed through a clinical lens, it is equally a health system, equity, and development issue. The ability of an individual living with sickle cell disease to access timely diagnosis, comprehensive care, and appropriate treatment should not be determined by where they live or their socioeconomic circumstances. Ladies and gentlemen, Ghana has demonstrated growing leadership in addressing sickle cell disease as a public health priority. The National Sickle Cell Disease Strategy, as mentioned by the chairman, continues to provide a framework for coordinated national action, guiding efforts to strengthen prevention, early diagnosis, clinical care, commitment, community engagement, and long-term support to people living with sickle cell disease. Again, the harmonized national guidelines that have been mentioned for sickle cell disease screening and case management have further strengthened the clinical environment by providing a standardized framework for evidence-based care across all levels of the health system. Their implementation would be critical to improving quality of care, reducing variations in clinical practice, and ensure better outcomes for patients. WHO also continues to support Ghana's efforts to strengthen services for severe chronic non-communicable diseases through what we call the PEN+ approach. PEN+ stands for Package of Essential Non-Communicable Diseases, which focuses on sickle cell disease, type 1 diabetes, and rheumatic heart disease. This year, WHO is supporting the Ghana Health Service in developing Ghana's PEN+ operational plan to guide a systemic scale-up of services nationwide. Building on the experiences from the initial implementation in 2 sites, Ghana is preparing to expand PEN+ services to 4 additional facilities and strengthen the capacity of health workers to provide specialized care closer to communities. Ghana's efforts are taking place within a broader continental movement to improve access to care for services of severe chronic diseases. Later this month, countries across Africa will convene in Tanzania for the International Conference on PEN+ to share experiences, innovations, and lessons learned in strengthening integrated care for conditions such as sickle cell disease. Distinguished participants, WHO also welcomes Ghana's recent rollout of the Free Primary Healthcare Initiative. This bold national reform presents an opportunity to strengthen equitable access to essential health services and accelerate progress towards universal health coverage. For people living with sickle cell disease, the Free Primary Healthcare Initiative provides an opportunity to strengthen early diagnosis, continuity of care, referral systems, long-term disease management. It offers a very great platform for integrating sickle cell disease services more effectively within routine health service delivery and ensuring that access to care is not determined by geography or the ability to pay. While important progress has been made, significant challenges still remains. Many individuals living with sickle cell disease continue to experience delayed diagnosis, limited access to comprehensive care, and barriers to specialized services. Challenges related to workforce capacity, surveillance systems, patient registries, availability of essential medicines, and sustainable financing continue to affect service delivery and patient outcomes. Across the African region, countries continue to grapple with questions of access, affordability, workforce capacity, and continuity of care for people living with sickle cell disease. But the good news is that we know what works. We know that early diagnosis saves lives, and we also know that newborn screening programs improves outcome. We know that access to comprehensive care, hydroxyurea, vaccination, infection prevention, patient education, and strong referral systems significantly reduce morbidity and mortality. But then the challenge before us is therefore not the absence of solutions. The challenge is ensuring that proven interventions reach every person who needs them, regardless of where they live and their ability to pay. And so the World Health Organization continues to advocate for the integration of sickle cell disease services within broader efforts of the universal health coverage and strengthening primary health care services. Sickle cell diseases cannot be addressed through isolated projects or fragmented interventions. It must be embedded within national health system. It must be reflected in health workforce development plans. It must be incorporated into essential health service packages. It must benefit from stronger surveillance systems, implementation research, and sustainable domestic funding. Ladies and gentlemen, as we deliberate today, I wish to highlight 5 priorities for collective actions, some of which have been mentioned. First, strengthen early diagnosis and newborn screening programs. Second, expand equitable access to comprehensive and quality care, including essential medicines, diagnostics, and referral services. Third, strengthen surveillance systems, patient registries, and data use for decision making. Fourth, invest in research, innovations, and digital technologies that improve patient outcomes. And lastly, but not the least, strengthen partnership and ensure that people living with sickle cell disease remain at the center of policy and program design. These priorities are critical if we are to reduce preventable illness and premature deaths associated with sickle cell disease. The World Health Organization remains committed to supporting the government of Ghana, the Ghana Health Service, the International Sickle Cell Center, and all partners to advance these priorities through technical cooperation, capacity strengthening, normative guidance, and strategic partnership. Ultimately, our success will not be measured by the number of policies, strategies, or meetings we produce. It will be measured by whether every child born with sickle cell disease has access to timely diagnosis, quality care, and the opportunity to survive, thrive, and live a healthy and productive life. I thank you for your attention.
Thank you very much, sir. We are going to have a special address dubbed Beyond One-Time Donations. Why sustainable private sector investment matters for sickle cell disease in Ghana. This was to be done by Dr. Samuel Amotobing, but in his stead, it will be done by Dr. Christopher Mensah. He is the managing director for Tobinco Pharmaceutical Limited. Let's welcome him with a round of applause.
Thank you very much. So I'm so privileged to read a speech of Dr. Samuel Amotobing, who really wanted to have been here, but for an equally important assignment, he's away. Honorable Chairperson, distinguished guests, Your Excellency KKD, representatives of government and development partners, healthcare professionals, members of the media, ladies and gentlemen, a very good morning to all of you. I am honored to join you today at ISCC's third annual Sickle Cell Disease Conference, held in collaboration with the Ministry of Health, the Ghana Health Service, and partners, as we commemorate World Sickle Cell Day and reflect on the current state of sickle cell disease in Ghana, the progress made, the challenges that remain, and the way forward. This occasion is important because it brings national attention to a condition that too often remains invisible until a family member is personally affected. For many families, sickle cell disease means repeated hospital visits, pain crisis, anxiety, financial pressure, and a constant struggle to access the care and medicines their loved ones need. For health workers, it means doing their best with limited resources. For many children and young people, it means trying to pursue education, work, and their dreams while living with a condition that requires continuous support. Sickle cell disease is not a one-day issue. It is not only a World Sickle